HIMSS 2018 right here from the bright lights of Las Vegas as we introduce you to some of our CommonWell Alliance members. Time now to hear from Philips Wellcentive and Philips Global PHM Innovation Leader Kirk Elder. And Kirk, maybe elaborate as to what drove Philips Wellcentive to join CommonWell.
Yeah, absolutely. Interoperability is critical to achieve the value that we're looking for in healthcare. And with a drive for value-based healthcare, if you can't understand your entire ecosystem of data and patients and populations, you're really not going to be successful.
All right, speaking of being successful in the next 5-10 years, what's on the forefront? What are some of those visions that Philips Wellcentive, being in the Alliance, is really trying to strive to make happen?
I think it's really about adoption and scalability. I think interoperability is here. I think we've demonstrated across a number of fronts that it's possible, but it's really about how do we get adoption throughout the entire ecosystem, and how do we make sure we can scale cost effectively the rollout of all these interoperability capabilities that we've developed. Because the value is going to be exponential the more interoperability and the more adoption you have across the community.
So getting there, the keys to getting there, what would you say?
You know, maintaining focused on what the value is and what business propositions that you're really rolling out that drive adoption. So making sure that physicians are engaged in the process, making sure that physicians understand the value points that come out, and then the work involved like data quality, mapping out workflows, optimizing your EHR, optimizing, curating your informatics library. All of those are items that take a lot of work and a lot of clinician support. So it's really going to take physician engagement and maintaining the reason why.
So this one a little more specific here. So an emphasis from healthcare to hospital to ambulatory and now in-home settings. Can that work?
Yeah, absolutely. It's about transitions of care and making sure that every time the patient is routed to the next spot, they're routed to the next best spot. And that it's the most appropriate volume, keeping affinity with the patient in network. Interoperability is going to allow the consumer to have a better experience, because when they go from this site to that site, their records are going to seamlessly move over. And if they have a better experience, they're going to develop more of an affinity with that network and that health system, and you're going to see that health system begin to dominate their market.
He's Kirk Elder, Philips Wellcentive, one of our proud members of our CommonWell Alliance. And for more on Philips Wellcentive, we invite you to log on to commonwellalliance.org. Thanks so much, Kirk.
Thank you.